Welcome to Drtidy. My name is Dr. Avi Shah, consultant pediatric orthopedic surgeon at NHSRCC Children's Hospital, Mumbai. And today I would like to talk to you about what parents really must know about a common condition known as walking or bowing of the knees. This is a fairly normal condition which we see every day in our clinic with worried parents, as this condition affects the way the child walks. First, we will talk about walking. Walking is a fairly common condition, and normally when you see young children, you will see that their toes are turned inwards. It normally goes away as the child grows and becomes straight by 9 to 10 years of age, and then the toes start turning outward a little bit in late childhood and adolescence. Usually these conditions go away by themselves, but if they persist, your child will need some form of treatment. The most common causes of gait are: the first condition is known as hooked foot or metatarsus adductus. This is a fairly common condition seen in infants where the foot is turned inwards. This condition is caused because of the tight intrauterine position of the child in the mother's womb, and which causes constriction of the foot. This usually disappears after birth by 12 months of age. But in some children, this condition may persist and the feet may be stiff and still turned inwards. These children will need some form of examination and treatment. The next common cause is known as tibial torsion or an inward twist of the leg bone. This is a fairly common condition seen in young infancy. Most of these twists in the bone usually correct by themselves as the child develops, and this usually disappears by age 9 to 10 years. Some children may have persistence of this twist in their bone, and if it persists beyond age 9 to 10, these children will definitely need to be seen by a specialist and will need some form of treatment to correct their deformity. The third cause is known as femoral anteversion syndrome, or increased twist or internal twist of both the thigh bones. Normally, when children are born, they have an increased twist in their thigh bones, which normally reduces and becomes normal as they develop. In some children, when they walk, you will see that their feet will be pointing inwards and both their kneecaps face inwards. Some of these children also have a tendency to sit in a W position or like a Vajrasana position. Most of these conditions usually disappear as the child develops and reaches the age of 9 to 10 years. In some children, there could be persistence of this increased version, and these children continue to walk in this manner. These children will need some form of examination and treatment to help improve their gait. In children, usually do not require any special braces, shoes or inserts to help correct these deformities. These will only make them feel bad and do not correct any of the deformities. Children who sit with a W position, their parents can just make sure that their child avoids sitting in this position and preferably sits in a cross-leg position or sits in a position like they would sit on the chair in a 90-90 position. The next topic we will discuss is known as bowed legs or knock knees. This is a fairly common condition and a normal variant in development. Whenever a child is born, they will have some amount of bowing of the legs. This normally straightens by 12 to 18 months of age. Following this, your child has some amount of knock knees, which is maximum at 4 to 6 years of age. Following that, the limbs again fairly straighten to a normal position by age 7 to 8 years. This is a normal developmental course which all children follow. If your child is following within this developmental pattern, there is no need to worry about the position of the knee or the way your child walks. But if there is any deviation from this pattern and the persistence of certain deformities or the severity of the deformity is seen, then your child will need to be examined by a specialist and will need some form of treatment. Again, it is important for parents to know that there are no special shoes, inserts or braces that are required for treating these conditions, and they not only make the children uncomfortable but also do not help correct any of the deformities. If there are severe deformities, your children will need some form of surgical treatment at times. Nowadays, we have newer minimal invasive techniques where we use the power of growth, known as growth modulation, to treat these deformities and early correct the child's gait pattern. So, dear parents, don't be worried. Understand the normal development of your child. But if there is any deviation or there are any doubts, please don't hesitate to show a pediatric orthopedic specialist for any of your child's conditions. Thank you for listening to us today. For any doubts, please get in touch with us. Thank you.